Facebook, hey Instagram, hey whoever is out there watching. Welcome to the Dr.Rad show, which is really the Dr. Storey show. This is, you have no idea how long I've been waiting for this. I love you.
Love you, brother. I love you.
This man, and honestly, and I gotta take a second, he's changed my life. He's changed my life for many, many reasons. Not only is he a friend, not only is he a young colleague in town, he has made it okay to be compassionate and loving with patients. When everyone tells you, no, 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 keep your distance, put up the wall. This man breaks the boundaries, and that's why we're talking about the doctor-patient relationship. So, Dr.Raul's story, I could go on and on and on about you forever, but he's a hematology oncologist, and that's it. Big words for any blood disorder and cancers, right?
Correct.
And so that's very, very personal subjects, obviously. But that's another reason why I wanted to talk to you about the patient-physician relationship. And we're going to get to all that in a minute. First, I want to give a shout out to Philly, the designer of this fabulous t-shirt, which is awesome. All right, second, we're going to give you a t-shirt.
Oh, this is awesome. Thank you, man. This is great.
You're welcome.
Thank you.
You're welcome.
Thank you. This is great. I'm going to just wear it.
No, you're not.
Yeah.
We're twins.
We're going to...
Oh my God. Be brave, be bold,
exactly.
Be rad. And I love it. So Morningstar Screen did this for us. They're printing people who do this for the shirts. And these, obviously, amazing. And obviously, it comes from the website. We might have it so you guys can actually buy some or get some. And we're certainly going to be giving some away, especially to patients who rock their goals. So short of that, that's the fun t-shirt thing. So Raul and I sit on many things. One of the newest things we do is a VNA consulting board for physicians, which is wonderful. It's about local community stuff. But I want to hear, just rattle off all of the things that you're involved in. I know one of the main things for me was the 2019 Man of the Year for leukemia, right?
Yeah, that was a beautiful project. You know, I got nominated from the Leukemia Lymphoma Society to be Man of the Year in 2019.
That's awesome.
So it was a beautiful project because 20 people together, we gathered together to raise to this fundraising, and basically we went over a year, raising money for the Leukemia Lymphoma Society. They do a phenomenal job. And then at the end, we were very proud that we were able to raise over $1 million.
Over $1 million.
And all that money will go to the different activities and the different services that Leukemia and Lymphoma Society provide. Yes, in regards of research for cancer, providing education for cancer patients, and many other activities they do, and they get involved. So all that money goes to research and to that type of services.
So tell everybody where you work. Where is your office? Who are you associated with?
Welcome to my house. It's so great to have you guys here.
That's awesome.
Jason is my brother for the last 10 years. We have been together as colleagues, as very, very close friends. So it's a real pleasure to be invited to your program. And Philip, who is behind the cameras, we're very happy to have you guys. So I'm Raul Storey. I'm a hematology oncologist, and I'm originally from Venezuela.
Yeah, that's weird.
Yes, I did my training here in the United States, 20 years ago. It's like time flies. But
because you're so old. Yeah. You're so old.
But yeah, I have been in this community in Vero Beach for around 10 years.
Right. Yeah.
And I think we
came at the same time.
At the same time.
Which was awesome. Yeah.
And simply, I'm just a hematology oncologist that has a lot of passion for enhancing the experience of being treated for cancer. What I want, what I'm looking for in my career is what are the different things that I can do to create this space for patients that are going through their cancer journey into an enhanced way where it can benefit their life.
I love the way you said that.
And it can benefit my life as well.
Yeah,
because
I love the way you said that.
Once you have that opportunity to serve and to be in that space with people that are going through that.
To better them, right? To help them through this journey, guide them through it. But they know that this relationship is not just going to be this positive, lovely relationship, right? It comes with some pain. It comes with some It's a journey.
Some struggle, some journey. It requires, support from your physicians, your nurses, from all your family members, because cancer is not a disease that only affects the patient. It affects everything around the patient. It affects your parents, it affects your siblings, your kids, everyone.
You were talking about the journey, and it's obviously not just the doctor. It's your nurses, it's your staff, it's your MAs, it's the people who answer the phone.
Correct.
Right? It's everyone. And so staff is so important. I just think that's awesome. Which reminds me, this is the time where you have to say hi to your mom.
Hey, my mom, of course.
Yeah,
and I'm sure she's going to be here watching this.
That's right.
Oh, yeah. So, Mom, I'm sending you tons of love. Jason, you have to say hi to
Hi,
your mom.
Mom. How you doing? Hi, my mom, because she'll kill me.
Yeah.
She'll kill me. Don't worry. She'll be chiming in anytime now.
That is awesome. That is awesome.
That's what it is.
Well, I'm sure Mom is enjoying our conversation.
Well, so my mom is a nurse of, she's going to tell you 51 years. I'm going to tell you it's 53. And so she, I was raised by a nurse.
Yeah, I actually met her before. I met her before. Yes, it was lovely.
She
lovely lady.
is an old soul like you, my friend. So, okay. So, all right, I'm going to do the thing I always do, which is called rapid fire. So I'm going to nail you with some questions.
Sure.
But then I still want you to, I want to go back and I want to touch on the Florida cancer stuff. I would just touch on all that because you're a part of this community in such an amazing way, but you're a part of something much, much bigger, which is amazing. I mean, you don't, he said he raised $1 million. This man has probably raised $10 million in various different, maybe more. Maybe you'll tell me. I don't know. Maybe you'll tell me. I don't know. He's so modest that this is going to be like squeezing, what do they say, squeezing blood out of a turnip. Like, this is going to be tough, but I'm going to get him to give me a number. But, rapid fire question.
Sure.
All right, ready?
Shoot. Ready.
All right. Everyone wants to know, where do you work out?
Work out, Quail Valley.
Quail Valley. Okay. What is your favorite diet when you want to lose some weight?
Well, a low carb.
Low carb, so like a keto.
Yes, kind of like keto, like protein.
Okay. If you could go back to any age and start over, what age would it be?
My favorite age is the one that is coming.
Ah, I hate you.
I love.
That was beautiful. The one that is coming.
Like
Who says that? Who says that? All right.
Yeah, it is true. It is true. It's like I love every single phase of my life to the max. Like, I actually don't want to go back to any of them because I love them so much that I'm looking forward to explore the next phase.
All right, Philly, that's the next T-shirt. I'm looking at the next day, whatever's next. Okay, a couple more questions. Ready?
Sure.
Favorite country you've ever visited? You're a traveler, I know.
Spain.
Spain. Hands down. Now, Spain or one of the islands?
No, actually, Andalusia, which is the south of Spain, but specifically Seville. I'm in love with that city.
Okay. If you could, hair or no hair?
Well, I think I don't have that much choice.
If you could.
No, I love no hair.
Women love the no hair.
I love no hair. I love.
But you got plenty of hair everywhere else. So, okay. All right, that's enough rapid questions. Okay, so talk to me about some of your philanthropy stuff.
Sure.
You do a lot of stuff.
Sure. And so I was, what I was telling before is like I'm passionate about like how can I enhance the experience of cancer, of the experience of going through the cancer journey, because cancer is just it's like the simplest way to mention in one word such difficult and cumbersome and convoluted, universe of experiences,
100%.
That doesn't affect only the patient, but affects so many different lives around the patient who is going through cancer.
Oh, absolutely.
So what are the things that I can do to enhance that? So yes, we have been involved in several projects that I love. One of them we can talk about our Florida Cancer Specialist Foundation. I have been involved with the foundation for 10 years. I'm part of the board now. I sit on the board of the foundation. We're very proud that with all the money that we raise for the foundation, basically is to help patients that when they develop cancer, many of them, they lost their jobs. Right. They're not able to afford their mortgage, their car lease, their electricity bills, their water bills. So what we're doing is the physicians, we support and we pay for all the administration costs of the foundation, 100% of it. So basically, every person that donates $1 to the foundation, they are guaranteed that 100% of that dollar will go to the patients.
100%.
100%. Because all the administration,
did you guys hear that?
All the administration
100%.
is covered by the physicians.
That's amazing.
So for the last 10 years, we are very proud to say that we have raised over close to $8 million, and we have allocated those $8 million in grants to patients in the whole state of Florida. Not only patients that come to our office.
And this is Florida.
It's like any patient in the state of Florida that is going through the cancer journey, regardless if they're treated in our office or in a different office, they can qualify and apply to our foundation.
So folks, if you want to know, and it's Florida, so it's your neighbors. It's your neighbors. You want to know that your money's going to work? Tell them where do they go? Where is
Florida Cancer FCS Foundation.
FCS Foundation.
Yeah.
Throw your money there, buddy. Throw your money there.
We'll guarantee 100% of your donation will go to the patients.
That's amazing.
So, yes.
All right, tell me about the headpiece. That's one of my favorite things. I follow you, obviously, on Instagram and Facebook. It's amazing.
That's great. That's great. You know, this is a project that we initiated a couple years ago.
Okay.
And I partnered with an amazing fashion designer in Miami. Her name is Catherine.
I love her. She's awesome.
She's amazing. She's amazing. She's so creative, and she's such an amazing human being as well.
Mm-hmm.
So we put our heads together a couple years ago, and we started brainstorming about what can we do in a way that we can impact patients in a positive way with what she does and with what I do.
Right.
So we decided to create this new e-commerce project brand, and it's basically a statement headpieces. And if you can call it turbans or you can call it headpieces, because it's going to be different type of headpieces. That what our goal is basically to empower women that are going through a cancer journey through chemotherapy, and we have seen firsthand how detrimental is emotionally for women when they lose their hair. So what we're trying to do is to create this statement headpieces, and we're going to have the whole spectrum of them. From the headpieces that they can wear to be at home watching TV, to go to the gym, or all the way to if they get invited to a gala, they can put themselves one of the headpieces and feel empowered and feel motivated to stand up.
How many pieces do you have right now?
We have already like 25.
Okay.
25.
That's awesome. All right. Where can they go see that?
They can go to wearegoddesssociety.com.
We Are Goddess. Did you hear it?
Wearegoddesssociety.com, and we partner with a very nice non-profit organization.
That's so cool.
Which is a nationwide organization called First Descents. It's they're nationwide, and what they do is they put together all these outdoor experiences where they take a group of patients that are going through cancer or cancer survivors under the age of 40. And they put groups together and they take them ice climbing, surfing in California, water rafting. And it has been well proven that all this activity help patients going through the journey, with their anxiety, depression, creating that sense of support and creating coping skills that they're going to use to go through their journey. So yes.
The journey. Yeah. The journey. All right. So we're going to talk more because in a minute I want to hear about the art stuff because I love art. I'm an art appreciator. I have no art skills. He's lying to me. He tells me he has no artistic skills, but he says he thinks he can develop these, right? So this is good. I have no artistic skill, but I can appreciate art, and you got an art program going on. Actually, you know what? Just tell us about that. It's such a cool idea. Was it your idea?
Sure. It's I bumped my head with Barbara Hoffman, who is a lady who I dearly love, and she's
a local, right?
She's a local, yes. Yeah. She's actually from Minnesota, but she has been in the community for many years.
Minnesota.
Yes. So, and she's in Vero Beach. She has tons of experience in the art industry or in the art field, and she was actually for 10 years the director of the Cultural Council of Indian River County. Mm-hmm. So we decided to work together and create this Healing Arts Medicine project where we put together a team of amazing professional artists We had a team of about 15, between 15 and 18 different artists, from painters, like storytellers, mindfulness training. We have musicians, we have like arts and craft, we have sculptors, we have everything, single activity you can imagine. And then we put them inside of the chemotherapy area. So they're creating all this collective experience with arts. Something as simple as putting a huge canvas in the middle of the chemotherapy area, and all the patients are painting, during their chemotherapy while they're getting the infusions. So they're working together towards these activities, and the impact has been amazing. So we're very happy. Of course, COVID has put a little stop into all that, interaction, human interaction.
I gotta just stop. You can even make COVID sound good. COVID, is COVID. That's amazing.
So we have a little challenge, with when COVID hits, because we are planning to roll this project around the state of Florida.
That's amazing.
So, but when, one door closes, another opens, another door is open. So we're in the process of
the journey,
creating the virtual platform where we're going to be able to offer all these activities, artistic activities to patients.
I think it's amazing.
And creating even a global impact, because once you have it virtually, you can offer it all over the world. So we're very excited about that project as well.
As you should be. all right. So now I think you know the man. And the problem is he makes me feel bad about the things I don't do, which is amazing. Again, you can understand the compassion now, right? And I think there's a difference between compassion and empathy, actually, but maybe we'll touch on that. But I'm a huge fan of discussing the philosophy behind these things. But we kind of need to get to our talk now. So I want to nail you down, because I know what kind of relationships you have with your patients, and I know how special it is, and I just love it. It's interesting as a physician when I see a patient, right? And yes, it's the C word, right? It's cancer, whether it's breast cancer or colon cancer, or whatever it is. It's a big dramatic moment, and I've been doing this like you. I mean, since start of medicine, 20 years, right? I mean, so 10 years here in Vero, like you, and I get to the door, and when it's still a cancer patient, I have to take a deep breath before I walk in, because I know, like, the patient and I'm not bothered by the conversation. I just know we're about to take a journey together, right? Like, we're going to start our journey, and it starts with a handshake and a, hey, I'm Dr.Rad and blah, blah, blah. And I know when you refer to someone, and I know you refer a lot, right? And so I refer a lot. When you refer a patient to someone, you're putting your name on it. Your stamp of approval. You say that I'm sending you to Dr. Raul Storey. He is great, blah, 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 blah. And if they show up at your office and have a really bad experience, it comes back, right? Yeah. So, and plus, I want that journey to be very personal, right? So that's why I chose you for this talk, because I know you're so passionate, your patients love you, but there's a reason for that. It's not, your patients love you. That's great. Why? Why do they love you? So that's why I wanted to talk to you about this. Okay, so I'm going to start with a couple questions. So one, oh my gosh, I didn't know that. I didn't know our videos have over 30,000 views, Philip. Why didn't you tell me this?
Yeah.
Woo! Thank you. That's amazing.
Read your emails.
Read your emails. Share. If you like it, share it. That's all I'm going to say. All right. These are not rapid fire, but let's keep them quick. I'll give you 3. You get 3. You can prioritize them. Okay. What are the key elements to a good physician-patient, doctor-patient relationship?
Okay.
It's tough.
Yeah, I'm gonna make at least 3 or 5, and in the order.
10.
Yeah, exactly. But in the order, I'm gonna say, it's not, in the order of importance.
Sure.
I'm just gonna mention them and maybe discuss about it. So, I do believe, first of all, one of the most important things in this relationship with a patient that is going through cancer, because it's very important to know, and that's one of my goals too when I talk to my patients, is like, you are not a cancer patient. You are just going through a human experience. You are not cancer. You are not your disease.
Ooh.
So it's like
You're Jason.
You are Jason. You are Jason,
And you have.
that now you are having your experiences cancer. But it doesn't mean you should not identify yourself with that disease. So it's like and a lot of psychologists use that concept with depression, anxiety, like different mental.
You're experiencing.
You
depression.
are
not depressed.
You are not
experiencing.
depressed. Exactly. I'm Raul Storey, and my brain is experiencing depression.
Okay, but you got to put a word on it. What is this called?
Correct. So the important thing is understanding first that this patient is so vulnerable in a space where they're so vulnerable.
Right.
You have to respect that. So having respect for the space that you're sharing with someone that is going through that.
And this goes for all physicians,
All
right?
physicians.
A nurse practitioner, anyone who's seeing a patient like this. I don't care what they came to you for. They came to you for a cold.
Correct.
They came to you.
And they came to you because they were not able to solve it by themselves.
That's right.
Because if they knew how to solve it, they wouldn't come to your office.
You call a plumber because
Exactly.
you couldn't fix the plumber. That's right. I
So
agree.
they are in such a vulnerable place. You have cancer. And we have the idea, and we can go deep into that topic as well. In the old days, cancer was paired like a death sentence,
Right.
which is not anymore like that in certain cases.
Many cases.
Exactly.
Many
cases. Like with many advances we have created and over the years on treatment, many times we have been able to convert cancer into a chronic disease, where patients will be able to live with cancer for many years with treatment for cancer, but maybe dying of something else.
Right.
So creating that mind shift, that not the fact that you have or you're experiencing cancer doesn't mean you're going to die from it.
Right.
So that is one thing. So, but we're not there yet,
That's right.
And I have been
That's
doing
right.
this for many years. You have been doing this
That's
for many
right.
years, and we can have this conversation. But a lot of people are not ready for that.
Correct.
You are not ready to hear you have the C word.
Right.
So they're scared. They're vulnerable. They don't know what to do. They have the mindset that absolutely is a death sentence. So what's going to happen with my family? What's going to happen with my life? So there's so many things going around that you need to respect that.
Okay, so number one would be
Respect.
Respect. I like that.
Yes. Number two,
Okay.
I think empathy. Empathy. And
Now hold on. Let's define empathy, because I wanna. That's an interesting thing. We were just talking about empathy and compassion. And compassion is like, okay, I am compassionate for, you broke your toe. I have compassion for that. That's great. I know that must hurt. Whatever. I would say empathy. The easy definition is like putting yourself in that person's shoes.
absolutely.
But I would go further.
Mm-hmm.
I would say empathy is walk a mile
Correct.
in their shoes.
Correct.
To know it like you know your name.
Exactly. And understanding, this is like kind of a cliche in the medical field, but it's like, hey, you should treat your patients like they're your family members.
They're your mother, right?
It is true. You must treat every patient that is like your mother.
But Raul, let's be honest. Isn't that exhausting?
Well, this is like we chose. We chose to
Did
be
you
here.
hear that? You chose.
We chose to be here. Nobody's forcing us to be here.
Physicians of the world. You chose it.
Exactly. And nobody forced us to be here.
That's right.
So
You chose to be here. I love that.
exactly.
You chose
So that's
Thank
why.
you for
Yes.
that.
And
Thank
it's not easy.
it. No, it's
not easy.
It is exhausting.
And nobody said it was gonna be easy.
That's right.
But we chose this path.
And I will say, if you treat everybody like you treat your family, there is tough love.
Yeah.
There is tough love. There's honesty.
Correct.
Right. I love that.
So-
empathy. So empathy.
Okay, number 3, let's be a good listener.
Oh, and that is so tough.
Be a good listener.
That is tough.
because
What do you
know,
mean? What do you mean?
What I mean about being a good listener is like sometimes we say, oh yeah, we doctors we listen what the patient says, like, but actually I don't know that many of us, we're in a rush all the time. Like physicians are in a rush, so we need to stop and really listen and get to know our patients. Be
Now,
personal.
I gotta ask you because I'm being raw here.
Yeah.
I'm not a good listener.
Okay.
I have tricks for that.
Mm-hmm.
So like, I know I'm not. So I'll say, repeat that back to me, or I'll say, so what you're telling me is, and I'll repeat it back to them to show them. I think I heard you correctly. Am I right? Do you have tricks?
Yes, I do have a trick. My trick is...
Or not tricks. Do you have a
I have a tool.
A
tool. What I do is before I get into the room to talk to a patient, I study my patient
Right.
to the point.
Good.
I know every single thing about the patient before I get in. So I know it from the records. I know it because my nurse practitioner went first and gathered all the information and then go back and explain me everything that is happening. Because I saw all the biopsies and scans and everything. I would say, if I have to put a number to it, 80% of the time, I already have a plan in my mind
Done.
before walking in the door.
Right. I love
And
it.
of course, I'm talking about like paper. I just review paperwork and I heard what my nurse practitioner said.
Right.
With those two pieces of information, 80% of the time, I already know what the patient needs. Not needs. I'm sorry. I'm gonna take that back.
Yeah.
What the patient, what the disease
Regimen.
needs.
Yeah.
What the disease needs. Not the patient.
What the experience
What the
needs.
disease needs. I already know that 80% of the time.
Right.
And then, when I walk into the room, my goal is gonna be to get to know my patient.
A relationship.
To get to know. It's like, I already know what I think it could be the good route to treat the disease.
Right.
But now, understanding that many patients, what we think it could be good for the disease might not be good for the human.
I'm gonna stop you because you just hit something that is just, it blows my mind. Okay, I want you guys to think about something. For years we've talked about physicians being replaced by robots. And I know that you think that's cute and funny, most people, that it is real. Like Google has made radiology, computer AI that is as good, if not better, than our radiology. Much better, right? Like, there's a new thing called, it doesn't matter what it's called. We won't talk about that. But it's a physician online, and it's a AI, and you just answer a couple questions, and they got your diagnosis and give you your antibiotics. You just said perfectly what I have been saying for years about why this can't happen, not right now at least. 80% of medicine is an algorithm. It's an algorithm. It's a calculator. Hit a button, there's your answer. Same with surgery, same with
We have guidelines.
It's a guideline.
We have guidelines, we have techniques to do surgery.
Or it's considered malpractice,
Exactly.
right? Like there's an
If
algorithm.
you go outside of that, it's considered malpractice.
That's right.
So
It's the 20% that the computer will never get. It's the 20%. It's the respect for autonomy. That's a patient. That's their experience. Who's the boss? Are you the boss?
No,
You're not the boss.
We just serve them.
We serve the patient.
Correct.
And I tell my patients that all the time. I say, listen, who's the boss here? And they think it's a trick question. Like they're like, you? Me? I'm like,
I work for you.
you're the boss. You're the boss. I'm going to give you some information. I'm going to help you make an educated decision. I love that. I love the way you said that.
So yes, it's like, I put together, all the information prior to getting to the room. And when I walk into the room, my goal is to get to know my patient. It's like, but when I say to know, it's to know them deep. To know them is like, what are your life goals? What are you looking for into this relationship? What do you want if I tell you have something? What do you... Because it's not the same, and you will understand, going through this, in this field, it's not the same someone, like a patient that you can have 5 different patients with exactly the same disease.
Right.
And the answer to treat the disease should be the same. But you have a patient that tells you, doctor, I have lived my life, I'm good. You know what? I want to continue having my great quality of life. I don't want to do anything. Leave me alone.
There you go.
I'm happy. I just came to shake hands and that's it. Perfect. That's one. But there is another one, there is another patient that tells you, hey, I want you to keep me alive for 10 months because I want to see my granddaughter graduate from college.
And then there's
That's
the one
when
that
that-
says, I'm all in.
I'm all in.
I'm all
do
in.
whatever you need to do to treat my disease. So that's the part I want
That's
to
it.
learn. I want to learn when I get into the room.
That's
I want to
weird.
learn. And you know, we as physicians, as you well said, our goal is not to tell them what to do. Our goal is to show them all the information and all the different options of treatment and let them decide what
That's
fits
right.
them.
Let me help you make it.
Exactly. Let me help you.
See, you know, it's so funny. I knew I'd be passionate about this conversation, but I love this. Like, it's insane. Plus, the sushi is good, and so is the charger. So I showed up here tonight, and this man drops this insane food in front of me, and I can't. You've seen me take a few bites already, and I don't care. You can watch me eat and stuff my face because it's amazing. All right, so we're gonna move on a little bit because I want to ask a few other questions here. So we already talked about something I think is important. It's called shared decision making, right? They're the boss, we work for them kind of deal. At the same time, what happens when you disagree? And I'll tell you, I've disagreed on some occasions. Like, let's say it's a stage 2, maybe a stage 3. Stage 3. Let's just come up with this. A stage 3 colon cancer. But with modern medicine, maybe they've watched their mom, their dad, a little older medicine, and it was a horrible experience, and the chemo was bad, and the surgery was horrible, and there was all this misery, and again, you don't know. They're 60 years old, they walk into your office, you don't know what they've experienced, what they've seen, how their interpretation of this is, and you say you have stage 3, whatever, colon cancer, whatever it is. Now, you and I know with modern medicine, I can go cut that out, do it, and you can give them chemotherapy. And these people may have years,
correct.
years of great quality of life. But they say to you, no, I don't want any treatment. I saw my mom go through this, saw my dad. So now you disagree with the boss, right? Like,
I actually don't need to disagree.
okay, tell me about that. So,
Yes,
how's that
absolutely,
conversation? Tell me.
absolutely. You know, and you just mentioned before, like, we already know who the boss is.
Oh, that's right.
And we already know we are serving them. So as long as they're making that decision after they're well informed or the pros and cons of
There you go.
all the different options they have, it's great. Because
So you can let that go.
absolutely,
You can let that go.
because I am
You're a better
actually,
man than me.
I'm actually helping him to be happy.
Yeah, and I see that, but there's something to it, right? There's something to the whole but
Life is not what is good for you is not good
not
for
good
me.
for you. That's right.
Because you have a different past, a different life journey, you have a different goals in life that I have.
And that's important.
So what is good for me, it could be completely opposite. You would be like, what is Raul doing?
Right.
For me, it's my life. It's like what excites me, what makes me, like wake up every day.
Hear this, people. Hear this. What is good for you may not be good for me. That is a life lesson. That's not just a physician-patient related. That is a life lesson. And I agree with you. So I'm kind of pushing you a little bit because I agree with you. It's their path.
Exactly.
It's their journey. You're just there. And I also agree with you, and you actually said it. You got to the answer faster than I could get you there, which was all you can do is educate.
Okay.
You just give them what you've worked hard to obtain, right? Knowledge.
No.
You give them the knowledge. You make sure they understand. You make sure they understand that these are the outcomes with these various treatments. This is the outcome without them. What's your choice? And then you get on board with the patient. And you take them through their journey however they want to do it. I agree.
And once you understand that agree to disagree,
Agree to
it's okay,
It's okay.
things will go.
Beautiful,
Yeah,
man. It's
it's a life lesson.
But and again, I know that you're an oncologist and I'm a surgeon, but this goes for everybody.
Correct.
It goes for everybody. Now, there are some things you will never get me to agree on. I don't think patients should be smoking. I think that's not that is a known evil. You call it whatever you want. Like that is not good for you. Now I don't get to make that decision.
Correct.
They make the decision.
Exactly.
But you'll never get me to just say, okay,
But you need to respect.
I respect that.
Correct.
Right.
Correct.
Now, how about you?
Yeah,
You
it's
respect it, but
I respect it. I don't empathize,
you don't empathize.
but I respect it. I respect totally because it's everybody's journey is different. But you know, we're in a great time for healthcare and for doctor-patient relationship.
That's arguable.
Yeah.
What do you mean by that? What do you
Okay,
mean?
we're in a great time in a sense that now we have access to a lot of information. Patients have access
Right.
to a lot of information.
Dr. Google.
Exactly, or Dr. Google, or Netflix documentaries, you name it.
Mhm.
There are plenty. Today, patients have access to information, and they are aware that they are in charge of their own health. They own and they become a primary game players in their own health.
Okay.
It's not anymore when the patients used to come to the old-fashioned type of value. We're talking about 30 years ago,
Right.
where the doctor was the god and whatever he said was like, oh, nobody questioned that. But now we have patients that it's not anymore that you're going to come to my office and you're going to smoke 2 packs of cigarettes a day and drink a bottle of liquor a day, eat all the junk food you can,
That's right.
and then expect for the doctor to fix you. We already know that we can fix, at least in the cancer world, we can prevent up to 40% of all the cancers that exist just by changing behavior. And the behavior,
Oh, say that again.
again. We can prevent 40%, up to 40% of the cancers that exist.
That's right.
Just by changing behavior.
That's right.
So now the ball is on the other side of the court. Now the ball is on the patient side. You are the one who need to quit smoking. You are the one who need to quit, drinking. You are the one who need to quit your diet. You are the one.
All right. While we're here, I need to say it.
Yeah.
And I know you guys hate me. Throw a plug in for screening exams.
So yes.
Colonoscopies, mammograms. Throw a plug in there.
Yeah. Well, they're
You
like,
believe in them?
absolutely, 100%.
There you go.
100%. And the best, we can talk about like multiple different screening tests, but I would say the most like meaningful and powerful advice we can give here is like talk to your primary doctor.
All the time.
Talk to your primary doctor and ask, what screening tools do I have available for my age?
The PCPs are the gatekeepers.
Exactly.
They're so important, but it is your responsibility as a patient to encourage that.
You cannot outsource your health anymore
Yes.
to someone else.
So you said up to 40% with behavior changes. I'm going to tell you it's up to 70 or 80% of preventable death from cancer with behavioral changes and screening.
Correct.
Because I think we can catch most things at a stage 1, 2. And with good treatment and behavioral changes, I'm telling you, we can change that game.
We are making the change now.
We're making the change. So you're right. We're at a good time in health.
It's a great time. It's a great
amazing.
time to be a physician. I'm very excited, for the times to come and in the oncology field. I mean, I couldn't be more.
It's
happy.
amazing, right? You guys are.
We're helping people. We're changing lives.
Okay. Couple more questions.
Sure.
This is tough. I got a really good one, and I want to ask you. Two good ones. One's easy. One's tough. Building. What are we going to say? I love the way I said this, but building trust, which is very different than even building a relationship. You're my friend, Raul. I'm your friend, Jason. But do I trust you? If I, the trust fall, the whatever, do I trust you? You get 20 minutes, 30 minutes with a patient, couple times, right? How are you going to get them to trust you? Now you got to remember that it's current times. There's health grades. There's all these things. They're going to Google you. They're going to whatever. At the end of the day, they showed up in your office. How do you establish trust in such a short period of time?
That's a great question, and thank you for asking that. But let's see, if I try to summarize like the 3 key points into how to build trust, I would mention 3 things.
Okay.
Number one, never overpromise.
Ooh, that's like a business. What did it say? Over deliver, under promise, over deliver.
Never overpromise, never underdeliver, and get to know your limitations.
Can I just sum it up in one thing?
Absolutely.
I think everything you just said was be a man or a woman of your word.
Mm-hmm. Exactly.
Know your limitations. Don't tell somebody you can do more than what you can. Don't overpromise. Don't underdeliver. If you say you're going to do it, and be a man of your.
And if you say you cannot do it, be honest.
Be honest.
It's like, but I'm going to take it one step forward.
Okay.
It's like, yes, these are my limitations, but I'm going to help you, the person that will help you.
There you go.
So take it one step forward.
You know, one thing I love about you is that. So I went to Union and I spent some time at Hopkins. I spent some time at University of South Florida. So you go to these big name places. You spend time there. You were at Moffitt. I mean, these big places.
MD Anderson.
MD Anderson. Oh God, even MD Anderson. So when you're there, you're there, right? You're there. You're the one getting the phone calls, right? So then here we are in Vera, and sometimes people are like, well, I need to go to Moffitt, I think, and to get an opinion because we're just in Vera, right? And you're like, one thing I've always loved about you is you can separate yourself from your ego. For those of you who don't know, I'm a big fan of meditation. I'm a big fan of really self-awareness. And I've just found you to be one of the most self-aware people I've ever met. You can separate yourself from your ego. You can say, listen, let's send you to Moffitt for a second opinion. Absolutely. I've always felt that a physician who couldn't get a second opinion and couldn't take it earnestly maybe had too much ego in the game.
Or maybe his, how can I say that? His...
Say it in Spanish.
No, he's not confident with his knowledge.
Maybe that's it.
That's it.
Maybe
because when you're confident with your knowledge and you know your limitations, you know where you can find something better.
Correct.
So it is malpractice if you don't allow a patient to get something better than you can offer.
I agree.
That is malpractice.
I agree. If anyone ever says to me, I think that maybe that I say 100%. 100%. And I'll help you find that person.
Exactly. I will help you.
And I
will guide you to find the best second opinion you can get.
100%.
So yeah.
Yeah, absolutely. And also knowing that may not be my opinion.
Exactly.
And that's okay. That's fantastic. And I think that, so again, that's building trust.
Yeah.
That's
correct.
Building trust. Okay.
And you know something interesting is like, and I tell like my patients all the time about like the doctor's-patient relationship. This is like dating.
Oh,
it's like dating. Yeah.
Ladies, you cannot date this man.
It's like dating because it's like when you have a patient, you have a doctor, you can both be great humans. But if you guys don't connect, it doesn't matter how great you guys are. It doesn't work, the relationship. That person can be a phenomenal doctor. That patient can be a phenomenal human. But if you guys don't get along, who cares?
That's right.
Who cares if that's the best doctor?
Except.
So it's not, and I also put another example. When you jump on a plane, that now Philip is going to be going to Tahoe. When you jump on a plane, he doesn't even know who's flying the plane. He's jumping on a plane with 300 people. He doesn't even know who's the pilot. The beauty of healthcare, they can interview us. They can come to our office and get into our house. They can ask us questions. They can see if they like us or not. And they can fire us on the spot. That is the beauty of medicine.
On the spot.
Patients can say,
Did you hear that?
Patients, I don't like you, doctor.
Okay.
It is okay.
It's okay.
You don't have to like me. So
I love it.
So yeah, so that's
true.
You know.
And you can.
And
and it doesn't even have to be because you don't like their advice, you don't think they're, it can be because I just, we don't match.
I don't have rapport with him.
That's
It's
right.
like, and in oncology, it have to be something that you need to feel. You need to do this with someone you trust.